Good morning. Thank you all very much for joining us. This is our healthcare panel. We're entitled Putting Doctors and Patients Back in Control. I'm going to give a couple of minutes of introductory remarks before we introduce our great guests here. First of all, I want to start off with just a couple of reflections on healthcare. You know, healthcare is so important to us because it's the great equalizer. It doesn't matter if you're young or old, doesn't matter if you're black or white, conservative or liberal. When you get sick, you just want to get better. You know, I tell the story, there was a judge that came and testified before one of our committees who was rushed in an ambulance to an emergency room. And he described his fear. He thought it was the end of his life. And we've all been there. Maybe you've been in an emergency room yourself, with a loved one, with a parent, with a child. When you're there, you know what happens? If you're religious, you start praying. If you're not religious, you become religious and you start praying. You start negotiating with God. You just want to get better. And indeed, we are very blessed because we live here in America, not only the greatest country in the world, but home of the greatest physicians and healthcare systems in the entire world as well. The reality is, if you were to get sick, there's nowhere else you'd want to be treated. Indeed, many of the wealthiest people in the world come to America to get their health care. My middle child, who's now 18 years old, was born with a heart defect, needed open heart surgery before he was 2 months old. You know, there was never a moment that I thought, boy, I wish we lived somewhere else. I wish we could go to France. I wish we could go to Canada or the UK for him to get his surgery. As serious as that was, I was so grateful we were right here in America with the best doctors, the best surgeons, the best hospitals. Now, Sean's doing great. He's over 6 feet tall. He plays varsity sports, so he got through his surgery great. But, you know, there are also still a lot of problems with our healthcare system. The reality is, if you were sick, if you had cancer, you'd want to be treated here. But I bet you if I asked for a raise, if I polled you, I asked you to raise your hands, I bet you we'd all have complaints. It's too expensive. It takes too long to see your doctor. When you finally see your doctor, they can't provide for you the services they want because the insurance company won't let them do it. There's always some insurance bureaucrat or government bureaucrat getting between you and your doctor and your nurse. When you go see your doctor, you've got to wait forever to see them. Or if you live in a rural area, there may not be enough doctors or nurses. You may not have enough options to go get your care. There's so much paperwork. If you're a doctor or a nurse, you spend hours and hours filling out paperwork. There's so many problems with our healthcare system. It kind of reminds me of what Churchill said about democracy. It's the worst system of government except for all the alternatives. America's healthcare system is broken and we need to fix it, but it's still better than all the alternatives. Final thought I'll say is the Democrats think they've got answers. They had the Affordable Care Act over 10 years ago. They thought that was going to solve everything, yet healthcare continues to be too expensive. Then it was Build Back Better, then it's Medicare for All. Their answer is pretty simple. They just want to spend more money and put government more in control. America First has a different idea. We want to protect the vulnerable, those with pre-existing conditions. We want to make drugs cheaper. We want to put doctors and their patients back in control. And that's the most important thing. If you only hear one thing from our panel today, that's the most important thing. America First, what we believe is that doctors and patients should be in control, not government, not insurance bureaucrats. Now, I'm honored today. We've got this great panel of experts, senators, and congressmen. I'm going to introduce them briefly to you, and then we're going to go through some questions. We're going to have a great discussion. We've got some great American heroes, some great America First heroes. I'm going to start with Senator Mike Lee from Utah, over here to my right. Mike is already an icon in the conservative movement. I was telling him backstage, he doesn't need to study America First. He's been standing for America First principles from his first days in office. He was first elected in 2010. He's the ranking member of the Joint Economic Committee, the ranking member on the Senate Judiciary Subcommittee on Antitrust, Competition Policy, and Consumer Rights. Very important assignments when you think about the oligopolies we see forming in healthcare, thanks to the Democrats, thanks to Obamacare. He has spent his career defending the fundamental liberties of all Americans, advocating for America's founding constitutional principles. Prior to entering government, he was an attorney, and he clerked for Justice Alito. Let's give the senator another great round of applause. Also to my right, we've got Senator Mike Braun from Indiana, first elected to the Senate in 2018. Prior to that, he was a state representative in Indiana. But what I really love about his presence here today, what I'm so excited about, is his time as a successful businessman. Founder and CEO of Meyer Distribution, he built in his hometown of Jasper, Indiana. I was telling the senator backstage, so often we have folks in politics that have done nothing but be in politics, and I'm really excited we're going to get to hear his perspective as a large employer, somebody who's been in the private sector, who's paid for health insurance, in addition to his service as a U.S. Senator, and so it's great to have him here today. He serves on several committees, including Health, Education, Labor, and Pensions Committee, a very important committee of jurisdiction over health care issues. Let's give the senator a great round of applause. And to my far right, we've got Representative Kathy McMorris Rogers of Washington's 5th District. I'm so excited she was able to join us. A long, long time ago, we actually came into Congress together. We were members of the same freshman class together, and boy, has she come far since then. She's now the ranking member on the Energy and Commerce Committee, meaning she's going to be the chairman of the Energy and Commerce Committee come November, and that's very exciting for our country. She was first elected to Congress in 2004. She previously served as the chair of the House Republican Conference from 2012 to 2018, one of the most effective conservative voices for us in the House of Representatives, a great mom, a great leader. Please give Kathy a great round of applause. And finally, we've got Congressman Brad Wenstrup. He represents Ohio's 2nd District, first elected to Congress in 2012. But what excites me about Brad, and we're so excited for him to be here, are two things. He has dedicated his life to serving others. First, by becoming a doctor, and it is so important we have the physician perspective. So often the people making health care, as he was telling me before, have never treated patients. You know, the bureaucrats that want to tell you can or can't get this procedure have never been in an operating room, never been in a physician's office. Not only, however, was he a physician, the second thing that excites me, he later served our country in the Army Reserves as a combat surgeon. He's been to Iraq. He is a member of the GOP Doctors Caucus, the House Healthy Futures Task Force, sits on the Ways and Means and Intelligence Committees, especially on Ways and Means, a very important committee of jurisdiction. I want you to not only applaud him for being a great conservative, but also for his service to our country over 20 years in the military. Please welcome the congressman. I'm going to ask each of you, and I'm going to start with ladies first. We'll start with Kathy, and then we'll go to each of you, and then we got other questions. I really want this to be an open discussion. So even though we got questions for each of them, I've already encouraged them to jump in and share their thoughts. An open-ended question, I'd like each of you to answer the opening question. What does putting America first in healthcare mean to you?
Putting America first in healthcare means putting patients in charge of making their decisions, trusting people to make the best decisions for themselves when it comes to their health care. So that's what putting people first, and it certainly means opposing what we continue to see this drumbeat for, a one-size-fits-all socialized medicine in the United States of America. That's not the future that we want in the United States of America. It means building upon what President Trump and the Trump administration started with price transparency. I believe that this is fundamental to reforming our healthcare system and putting back the patients and the doctors in charge of their health care. Price transparency, which would require hospitals to put forward the prices of the treatment before you get that treatment. It would mean that there would be competition in the marketplace, and that's part of bringing down the overall cost. It certainly means opposing what Speaker Pelosi is moving forward right now. What we see her doing is government price controls, for example, when it comes to prescription drugs. All that means is that there's going to be fewer cures, fewer treatments. It's going to make us more dependent upon China for the future of prescriptions. So those are some initial thoughts, but there's a lot more too. So thank you very much, Governor, and it's great to be with all of you today.
Thank you, Kathy. Great. Thank you.
I think in order to put America first, we have to stick to what works for us. You can't beat China by being like China, as we say in other contexts. We don't want to become America first by becoming more like China, more like Europe, more like Canada. It doesn't work. What works here are free markets and institutions of civil society. Over the course of many decades, we've blocked those free market forces out. We've done it at the state and local level by having things like certificates of need, government permission to operate a healthcare facility at the state and local level. This is good for large, dominant market incumbents, among hospital chains, for example, because they often control the means by which it's decided whether someone gets a certificate of need to build a hospital. And it happens at the federal level through massive subsidies that also tend to go disproportionately to the market incumbents. It's also important, in order to put the free market back into action, to try to reunite as much as possible the consumer with the price point. Market distortions happen when that occurs, and as a result, people don't know the prices that they're being charged because there's a third-party payer. It started many decades ago when we started subsidizing on the employer side the acquisition of health insurance, and it's gotten worse as we poured more and more federal dollars into this system. It's estimated by some that 40% of the real per capita increase in healthcare spending from 1950 to 1990 was directly because of federal government subsidies. And so the federal government stepping in further separates the consumer from the price point. And then that in turn exacerbates the free market distortions caused by government at the local level and at the federal level. One of the best places to start, because this is an enormously complex system, doesn't have to be as complex as it is, but we've made it that way. But it can be kind of daunting in figuring out how to get back to it. The first step that we could take is something that President Trump started while he was in office. You reunite the consumer with the price point, and you can start that in baby steps, simply by allowing the employer to reimburse the employee for the acquisition of health insurance. Then the employee goes out and buys health insurance on the open market and can take that. That allows some of the tax benefit to go to the employee rather than to the employer. That's an important first step.
Thank you. Well said.
So I'm going to try to weave transparency, competition, getting the consumer involved in his or her own well-being, and tell you how it actually works and why the system is so screwed up the way it currently is. Imagine, I call healthcare an unregulated utility in the sense that they disguise themselves as free enterprise, and then everything they've done through state statute and at the federal level is to try to suppress competition. We had to do an executive order to get hospitals to tell us what things are going to cost. That's never going to work. The MBAs that I was schooled with a long time ago, they're just being rational when you have a system that doesn't engender competition, transparency, all of that. You're going to game it to your advantage. Bobby talked about it. When people get sick, have a bad accident, they have no skin in the game. They just want to know who's going to pay for it, and they want it quickly. And they're either going to look to their employer or government to do it. That's why it's 20% of our GDP. Back when I started wrestling with it, it was under 10%. I'm going to give you a little teaser here of what can happen. I was so sick and tired of my insurance agent coming in and telling me how lucky I was. It's only going up 5 to 10%. Any of you have run a business, you've heard that. Didn't make a lot of difference. I was a hard scrabble entrepreneur, had just 15 employees, basically the first 20 years I was in business. Started to grow back in the late 90s. From 15 employees to now we have 1,300. Had one little location. We now have 70 locations in 40 states. The check I was writing for health insurance didn't mean a lot. Not many of my employees were using it. But when the only way I could keep costs down would be by raising deductibles or changing underwriters every 3 years because it was so profitable, I figured it out. We had a come to honesty meeting back in 2008. My two sons had started working for me. My younger son, who's now CEO of the company, said it's going to be a tough meeting. We're going to find out how we fix it. They told us the secrets of why it's broken. Number one, they explained honestly, consumers are not currently shopping for their own prevention and well-being like they do for anything else. We fixed that by putting skin in the game from $1. I then wanted to look at the different variables you had to work with and change them all. May go into the details later, but I'll put this out there for you. Made it consumer driven. I'm trying to avoid a broken system because you're well, or you at least take ownership of your own well-being. We've not had a premium increase in 15 years. And I was able to lower family plans by 50% by putting that into practice. It can be done when you have the biggest lobbies in the country at the federal and state level and the smartest people that run it. It's like dealing with an unregulated utility.
Thank you. I think the question you asked was, what does America First mean to me when I think of it as far as health care? And I think it's about the American people. And also, it's not about the U.S. government. That, to me, is one of the biggest problems that we have. When I first ran for office, people said, why are you running for office? I said, I think we got people in Washington that are making business decisions that never ran a business. I started with my own practice with 2 employees and then joined a large orthopedic group. We got people making healthcare decisions that never saw a patient, and people making military decisions that never served. And but as I think about it with healthcare, it's about putting the patient and the doctor back in charge, which is the theme here today, and I greatly appreciate that. It's about making America the place for innovation in healthcare and new treatments and cures coming from America. We don't want to lose that, and we're at risk of losing that. It's about transforming our supply chain so that we have a secure domestic source of pharmaceuticals and everything that we need across the board for our national security and our national health security. And it's about increasing access and affordability. Democrats like to talk about how you have coverage through this or that, but that doesn't mean you have access, and that doesn't mean you can afford it. So what we are about is to try and make this the healthiest nation on the planet, and what we can do to keep Americans healthier. We met as a doctor's caucus during the Obama administration with CMS, and the woman from there said, you know, all the things we're implementing are really starting to work with their electronic health record and everything else. I said, do you know why we're here? Because you've taken the joy out of taking care of people. We got to get government out of health care, because right now, when government acts, insurance follows.
Very well said. You know, all these were amazing answers. One constant theme I heard in each of the answers was this idea about price transparency. One of the things I should have mentioned before, and I want to applaud President Trump in his first term, was the push towards price transparency. I want you to think about this. What service have you ever bought where you weren't told the price until after you received the service? You wouldn't buy anything like that, and yet that's exactly how we treat healthcare. And this sounds like a simple thing. There's a reason the hospitals are resisting the Trump rule, because this empowers consumers. And building on that, you know, Senator Lee, I'm going to ask you this for, and again, all these questions are open to everybody, but I'm going to start with Senator Lee here, because I want to build off of that. You know, you're a champion of the free market and limited government, which I think is fantastic. One of the misconceptions, a lot of people think that we've got a free market, a competitive system in healthcare today. And a lot of times Democrats want to make Republicans defend the status quo when we really don't have a free market in healthcare. And you mentioned some of the reasons with the certificates of need, the lack of price transparency. I'm going to ask you, what are some policy solutions that can help create a free market that truly puts patients and doctors back in charge of healthcare? And again, we've talked about price transparency and certificates of need, both great ideas. What are some other ideas, or building on those, how can we make healthcare more of a free market system?
Okay, so the first step is one that I touched on briefly at the end of my answer to your last question, which is if you allow the worker to get pre-tax dollars, get non-tax dollars, and allow the worker to purchase his or her own health insurance on the open market, rather than having the tax benefit following the employer, that's a big step in that direction in and of itself. President Trump started that. And naturally, given that it was a really good idea, President Biden discontinued it. It's what he does. And so I think that is an important first step. Another step that we can take in doing it is to stop expanding Obamacare. And in order to do that, I think we've got to make the case to the American people that Obamacare is bad, not because we disagree with it ideologically, but because it's hurting people. Now, we've all felt the effects of inflation. Inflation is the direct result of excessive government intervention. Too many dollars chasing too few goods. We've all felt it. On average, it's costing a typical American family $718 a month more just to buy their basic basket of household goods, their household necessities every month, relative to the beginning of 2021. That's been felt in healthcare to an even more acute degree. In my home state of Utah, between 2013, just before Obamacare kicked in earnest, and 2019, after it had been in effect for a few years, the cost of health insurance went up by 171%, meaning it was almost triple its cost since 2013. All of that is due to excessive government spending. And what do the Democrats want to do now? Oh, they want to double down. They want to do it more. One of the first things that they did after the Democrats took control of both houses of Congress and of the White House, they passed this awful bill that, among other really bad things that it did, it expanded what we were spending in the health insurance premium payments to those above 400% of the federal poverty line. And so we're paying right now $90 billion a year on that. $30 billion of that 90 in this program go to people above 400% of the federal poverty line. And by the way, of those people covered by that, 3 out of 4 of them already had health insurance. The whole idea of this program was to help people who don't have health insurance get health insurance, and we're doing that as well. And so all we have to do for important first steps is, number one, stop expanding our march towards socialized medicine. We need to stop the Democrats from extending this thing. It's about to expire. It's one of the things that they want to use for this Build Back Broker deal that they want to do. They want to extend that for another 2 years. We can't let them do that. And we've got to continue this step toward restoring free market principles by allowing the worker to buy health insurance, allowing that tax benefit to follow the worker rather than the employer. That would do more than any other single thing, and I applaud President Trump for taking us in that direction, and I condemn President Biden for taking us away from it.
Well said.
So what Senator Lee is talking about does make sense. I look at it just a little bit differently because I try to size up running something for 37 years. You got to kind of see, and I laid out the issues earlier. I put more blame on the dysfunctional industry. I knew Obamacare was going to fail when you had big government getting in cahoots with big health insurance. Government was going to have circles run around it by the folks running the insurance company. Should have been called the Unaffordable Care Act. For us to ever change this, I try to distill it into something much simpler. It is the biggest issue. If you get rid of all the other issues out there for Main Street America, is a high cost of health care. You just don't see it when you've got the border. You don't see it when you got crime in the cities. You don't see it when you've got the disaster we have as an economy currently. When that got up to 20% of our GDP, the only way that's going to come down, and I'll tell you how hard it's going to be. There was a local startup, Zionsville, suburb of Indy, put together their own outpatient surgical center. It was anesthesiologists and surgeons. I said, hallelujah. And that's breaking it from the grassroots up. Found out only one other place in the country, Oklahoma City. You know why? Every doctor, anesthesiologist, and surgeon got fired from their hospital job because big healthcare has such a stranglehold on the system. Listen what they were able to do. Gallbladder removal, $22,000 if you're insured in Indiana, negotiated rate between hospitals and insurance companies, $32,000 if you can afford it and you don't have insurance. They're doing it for $8,000. $8,000. They're paying themselves twice as much for their fee as they were before. And I tell the CEOs of these big companies, you better fix yourself. You know how tough it is. There's not a Democrat that wants to do health care reform. They want Bernie Sanders to run it. And we're getting closer than what you can imagine. We're probably 2 senators away from their crown jewel, here recently. I tell all you CEOs who run healthcare industry out there, get with it. Are you free enterprise and you embrace competition, no barriers to entry, and you do like what I did for 37 years. You succeed because you have the best value, not always the lowest price, but the best value in total. They're against it because it's been such a gravy train to date.
Thank you, Senators. Kathy, I want to ask you a question. You and the congressman have both introduced a bill that would prevent the government, and this is, especially, this is such an important bill when we talk about the whole point of the healthcare system is to promote Americans' health. And I thought, Brad, you made a great point about this. When Democrats talk about healthcare, they talk about coverage. What they mean is giving everybody a government insurance card. That doesn't actually necessarily translate into improving health. That doesn't mean that you actually get to see your specialist. That doesn't mean you can afford your deductible. That doesn't mean there's a provider in your community that wants to take care of you. So I thought this was such an important bill. So I wanted to give you and Brad a chance to talk about it. You introduced a bill that would prevent the government from putting a number on the value of a patient's life. For folks that aren't familiar with this calculation is sometimes, it's abbreviated QALYs, Quality Adjusted Life Years. It is used by socialist governments all over the world to determine the cost effectiveness of a healthcare intervention. So this is how other governments use this to decide who is allowed to get what types of healthcare interventions. Tell us, why was this so important? Why do we need the safeguard in America? And then, Brad, I'll ask you as well, why was this bill so important?
This bill is critical, ensuring that we do not follow countries like Great Britain or Canada in introducing QALYs, and the governor laid out what QALYs are, quality adjusted life impact, QALYs. But just know, this is what the approach that Speaker Pelosi is taking right now. She has legislation, H.R. 3, part of the way that she wants to control costs in the United States of America is by introducing QALYs. This means that if it is determined, maybe because you have a disability or a chronic illness, that your life just doesn't count as much as someone else's life. That's how they control cost in countries like Great Britain or in Canada, and you wait longer then. You might be waiting months or years to get the health care that others get. That hasn't been the way in the United States of America. We, in the United States of America, treat our patients equally. This is dangerous. It's a dangerous approach that is being debated right now in the House of Representatives and in the Senate in Speaker Pelosi's drug pricing scheme that she's bringing forward. But this is the way that they want to control costs. We have to fight this. We are on the side of protecting the human rights, the human dignity of every person. One other thing, so make sure that everyone knows, we got to make sure that QALYs do not come to the United States of America. And I'm proud to be working with my colleague, my friend, Brad Winstrup on this legislation, and make sure you get the word out. Thank you.
Thank you, Kathy, and I just love your passion on this, because to me, it just seems, especially as a physician, it just seems completely immoral to even invoke a system like this where you're deciding basically who gets care and who doesn't based on what they may predict. You know, and as a doctor, I can tell you time and time again, a lot of times people beat the odds. And they live a whole lot longer than you expect, and all those types of things, especially when there's new treatments, new innovations, and that's what we're really about. You know, we reached out to stakeholders across the board with our Healthy Futures Task Force, right, Kathy? And, you know, our goals are to reduce drug costs. We have H.R. 19 out there, which is a bipartisan set of bills that will really reduce the cost of drugs without stymieing innovation as opposed to what they have in Build Back Better. So I'd say to my senator friends here, I know Joe Manchin said he's interested in looking at lowering drug costs. That's fine. Why don't you have him take a look at H.R. 19 rather than what's in the bill, Build Back Better? But we want to get things to market faster. We want to get things through the FDA faster. Operation Warp Speed showed that we can do a lot, and we can do a lot faster, and also focus on treatments and cures. Again, it's about people's health span rather than just their lifespan. You know, we do pretty well at keeping people alive. for a long time, but how do we keep people healthier longer? That's really what we are after. We got a bill to enhance and to inspire and encourage medical manufacturing in the United States. Again, going back to the supply chain issue. We can do all these things. We're teeing them up. We're going to be ready to go. Let's win in November and get our policies out there.
Thank you. Well, just as a translation for the folks back home, every time you hear them say Build Back Better, that's actually big government socialism. That's what we at AFPI call that bill, just so you know. I want to thank you guys. That qualities bill is, I think, one of the more important pro-life pieces of legislation we've seen introduced in this Congress. Senator Braun, I want to ask you a question, go in a slightly different direction. We've been talking a lot about what can be done at the federal level. I was really impressed to read that you do an impressive tour of all 92 counties in your state every year. Which I think is great to get out there and see folks in every community in every part of the state. We talk a lot about what can be done at the federal level. I know you served in the state legislature as well. So much of healthcare is actually regulated, funded at the state level, especially given the Medicaid expansion that President Obama pushed through. What would be some recommendations you would give to your state lawmakers, the state governors, the state leaders out there, folks that are thinking, what can we do back in Indiana? What can we do back in our local communities? What can we do apart from what they can do in Washington?
So I served 10 years on a school board to boot. Imagine how that would be now versus back then. Healthcare was the biggest cost in our budget as well. We didn't do any of the things I did in my own business because it was too bought into what the union wanted, which was no skin in the game, reform nothing, just accept it and pay more. I do travel, visit all 92 counties. You learn a lot. The 37 years I spent in the real world having to outwit competition, make healthcare affordable. We're more likely to get things done at the state level. It's a labyrinth of rules and regulations that the big lobbies have put into place. I tried to do this same thing in 2015, had friends that were committee chairs, and I wanted to do three things. I wanted, if you're in the business of healthcare, you put it out there on the web or in print what the heck your costs are. That was mentioned earlier. I wanted to expose the real it glues the system in its current dysfunction. It makes it opaque. What are those third-party agreements between insurance companies and hospitals? Even if you're a large self-insurer, you can't see it. I wanted light on that. And then the other thing you always hear about, well, Medicare costs this amount, and it's less because we, as private employees, pay most of the bills throughout the healthcare system. I wanted to know how your price compares to that. It created a firestorm. Couldn't get a hearing, biggest lobbies again at the state level. It was when I was leaving the third year, they finally met with me, knew what I was talking about, made sense. What I told you about what the entrepreneurs did back in Indiana, what you can do if you embrace things like wellness, avoid the system, much easier to get done at the state level. The beauty of our system, the laboratory of federalism, is fix it there. Maybe it'll cascade into a place that's lost most touch with reality. Because here, it's as likely that Bernie Sanders will be running the system in the future as it is that we self-correct. I hate to say that. One of the ways to avoid it would be to show how it works like I did in my business or like we could across the states, and maybe not even embrace the federal government to fix it, embrace the laboratories of what you might do to find that secret sauce. That's where I'm going to put a lot of my emphasis as well.
Thank you. So, Congressman Congressman Wenstrup, I know that you'd mentioned the Healthy Future Task Force. For those that are not familiar, Leader McCarthy has asked the Congressman and others to help lead this task force, and the idea is to be ready when we win back the majority. We were talking before, if you wait till November to start then thinking about what you want to do, it's too late, because you've got to be ready on day one. You've done a great job. I know you chair the treatments subcommittee, and you talked about the work. Can you share with us some of the work that the Healthy Task Force has done, your subcommittee, and what can we expect? Let's hope and assume, pray, I don't want to take this for granted, let's hope and pray that Republicans do win in November. So if we're in the majority, what can we expect coming out of the committees, especially given the work y'all are doing today?
Well, I do want to give Leader McCarthy a lot of credit for putting this all together. And as we have these task forces, they're on energy and every topic that we can think of that we deal with. And so this has been a great opportunity, but it's not only for the people that are selected to be on different task forces, it's open to every member. And so every one of the task forces is open to every member to participate, which I think has been very good, which will really enhance what we put forward in the fall. But as I was talking about it before, we're about treatments and cures. We're about access to care, reducing the cost of drugs, and really the affordability of care. And so we have a lot of things that we have put forward, but it's also the process that's taking place in medicine today. I know the theme today is about the doctor-patient relationship, and I greatly appreciate that, because it's been stripped in so many ways. Imagine if you're a lawyer and a client comes to you and says, hey, I'd like you to defend me in this case, and you had to say, well, let me check with someone to make sure I'm able to do that first. Or, before I can write this contract for you, somebody has to give me permission. Someone who doesn't know you, someone who's not familiar with the case. That's what is going on in medicine today. We have to get prior authorization for everything. They tell us which drug we're allowed to prescribe for our patients. So we have bills that are teed up to combat that, to put that back in the doctor's hands with the patient so that it's not dictated to. But I've always said to the insurance companies, if you're going to make these decisions, then you need to see the patient. You should not be making these decisions for a patient you have never seen. To me, that's malpractice, and it's occurring each and every day. And with that, we've got to enhance the transparency. Thank you. We passed in a bipartisan fashion the No Surprise Act, which takes the patient out of the negotiation. If a patient has an emergency surgery, they don't get to choose who their surgeon is, and they may not be in network. We solved that. We solved it in a good way that made it fair to the insurance companies and to the physicians, taking patients out of it. And the government, HHS, changed our law, and it's in courts, and they're losing, but they keep appealing it. But let me give you one thing about taking physicians out of your care. Nothing is more egregious than the vaccine mandate. Look, I've been vaccinated. I was for the vaccine. It saved hundreds of thousands of lives. But the mandate, you have someone in politics who has no experience in medicine telling you, you must get this shot, and if you don't, you're fired from your job. Is this America? It sure doesn't sound like it. Where is the relationship with the doctor? There is no conversation with the doctor. It is government coercion rather than the art of persuasion, which is really what we call bedside manner in America. And they're taking us out of the equation altogether. And, Americans, by the way, don't do very well with I told you so after about age 4 or 5. I have a 4-year-old. I think it is 4. and that's basically what has gone on here. We've got to get the doctors involved with your care more. It's personal, and it's between you and your doctor, and every patient is different.
Thank you. We're running almost to the end of our time. Senator Lee, I'll give you one last question. I know that on the Joint Economic Committee, one of your priorities is reconnecting Americans to work. And I know under the Trump administration, states request, and they try to allow states to put in a work requirement in Medicaid. The enrollment in Medicaid has grown over the last couple of years to over 80 million people, mainly from the addition of able-bodied adults. We did a poll, AFPI helped do a poll, 68% of Americans support the idea of work requirements in Medicaid. I'm just curious, and I know we don't have a lot of time, but as you look at Medicaid, this federal-state partnership, what are some thoughts you have in terms of how can this program be better run so it truly is providing that safety net for the most vulnerable Americans out there?
First step is always to acknowledge the existence of a problem, and Medicaid now costs us $671 billion a year. Now, this is starting to rival what we spend in defense on an entire year. Last I checked, defense is one of those things that we have to do, that we're unambiguously directed to do and assigned to do under the Constitution. Healthcare is not. We've got to start looking for an exit ramp for the federal government. I'm sorry, but outside of its own military personnel and its own employees, There's not really a good place for the federal government. When it gets involved, it distorts the market and impoverishes the states. So a good place to start with that might well be a work requirement for able-bodied adults, especially able-bodied adults without young children with whom they have to stay home to care. Because at the end of the day, if we are making poverty something that we are subsidizing, that we're encouraging, we have to look at it not from the standpoint that it's harming the government, it's harming the individual. When you do this, you create cliffs. Those cliffs artificially disincentivizing people from going out and getting a job. Without that first job, they're never going to get the second job. They're never going to get the promotion. Human flourishing doesn't occur. We have a duty, just as Dr. Wenstrup does. First, do no harm. We're harming the American people. Let's get out of this nonsense.
Well, I want to thank each of our panelists for doing a phenomenal job. We could have easily spoken for another couple of hours with each of these experts. Before I give you a couple of closing thoughts, let's give them a round of applause for their great comments and their great experiences. Thank you. Two final thoughts. You've heard us talk a lot today about putting doctors and their patients back in control. What's the alternative? And if you're not worried about the government controlling your lives, you've not been paying attention these last 2 years. So many things we've said would never happen in America. So many times people say to conservatives, you're just crazy to think the government wants to control your health care. You're just crazy to think that the government wants to tell doctors how to practice medicine or to tell companies what kinds of new devices and products they can invent and put on the market. Think about what we've seen in the last 2 years. Did you really think you live in a country, did you really think in America that would force our schools to be closed? They'd force our kids to be at home. They're talking about putting masks back on kids again. As Brad talked about, they talked about violating that sanctity of the physician-patient relationship. Did you really think you'd live in a country where you'd see critical race theory being forced down the throats of our kids and indoctrination in our public schools? So if you're not afraid of government taking control of our health care, you haven't been paying attention. And so the first thing I would say is this is one of the most important things. When we talk about government taking over more and more of our lives, health care is personal because it matters to all of us. But then secondly, I want to say there is an alternative. I want to encourage you all, go to AFPI's website. Thanks to Dr. Heidi and many other great folks, and thanks to your input, we've got great policies, many of which you've heard talked about today, including price transparency, including empowering patients, including empowering doctors, including lowering the cost of health care without jeopardizing innovation. The most important thing to remember, we've talked a lot about facts and numbers and figures and acronyms, and these guys are all experts. It all comes down to one simple question. When you think about healthcare, who do you want to be in charge? Do you want it to be physicians and patients, or do you want it to be government and insurance bureaucrats? That's what it comes down to. Thank you all very much, and enjoy the rest of the summit. Thank you very much.